Hey guys, welcome to Herding Little Cows. It is October 4th and it is about a little after 9 o'clock at night. So happy birthday to Mike Stockwell and to Cy Ten Kate, but it doesn't look like you'll be sharing a birthday with this little guy. So the pregnancy update for today, I am 38 weeks, 6 days. That means I'll be 39 weeks tomorrow. And we had a really good day. The morning started out, we did our regular breakfast time. The walk didn't happen because it was rainy here this morning. And then we went and did Bible time. And then we went to the grocery store. So if you want to see what we bought at the grocery store today, we got some really good deals, and that would be on the grocery haul video. Came home and we were enjoying the afternoon. It came to about 3 o'clock and Mark felt he needed to lay down for a little bit because we were going to go do evangelism tonight, and I thought, yeah, it'd be a good idea to go put my feet up. I came in to put my feet up and I suddenly got really, really nauseous and have stayed nauseous the rest of the day. So I'm hoping that's an early labor sign, but it could just be that I ate something funny or something like that. So I'm annoyed by this little piece of hair that I can see in the thing. Sorry, I just got out of the shower, so there we go. That's gonna not annoy me anymore. So anyway, so I felt really nauseous. So Mark took Virginia, who's 16, Naomi, who's 12, and Samuel, who's 9, out to do evangelism today, and they had a really, really interesting night. I won't share all their stories, you can see on our Facebook page, but Virginia had specifically prayed to be able to share the gospel with people, not just through a tract, but be able to actually talk to people. And she had the chance to talk to multiple people tonight, including a girl that lives right down the street from us that we've never met before. She lives on a busy road next to the road we live on, but now we know that she's around. She stayed and listened to the preaching for about half an hour and then talked to Virginia for about half an hour. So that was a really interesting night for them. It was cool out there in Rockland, but because I was feeling nauseous before we were supposed to leave, I decided to stay home with the little 3. And it was quite a blessing. I wish I had been able to go out to do the evangelism, but my nausea started to go away somewhat, and I was able to just do some fun stuff with them. We got paint out and we made a bunch of pictures, and we had a jam session where we were singing Holy, Holy, Holy and Joy to the World and all kinds of stuff while they were playing our broken guitar and recorders, which they don't know how to play, and a cajon. So it was a nice night to enjoy the littles before this little guy comes. So that's it. Nothing new on my end. I'm tired, so I'm going to be headed to bed here in a few minutes. What else? I think that's all for pregnancy update. For anyone who has been praying for Uriah, the 2-year-old who burned his hand, it has healed amazingly well, and we were given permission by the doctor for all bandages to be off and everything. So he is going about his normal day, but every once in a while he remembers it's there and he'll just hold it up and walk around the house holding his hand up. But normally he's just playing. So what I was going to talk about tonight was baby care at the hospital. I have always wanted my babies to stay in the room with me, to stay where I can see them for the most part. And Daddy would walk down to the nursery with them if they had to be weighed and measured. But if they had to take them at another time that Mark wasn't there or something, I would let them take them out of my room and take them to the nursery. And there's not a problem with that. If that's something that you're choosing to do, or if baby needs to go to the nursery, we do not have a high care nursery here at our hospital. So they won't let you deliver at this hospital a baby that's under 36 weeks. A baby that's under 5 pounds gets transferred out. There's a whole lot of things that babies get transferred out for here because we have a small hospital. They take great care of the babies, but they're just not ready for any preemie type care here at our hospital. So we have never had a baby who's had a significant health issue that needs to be in the nursery or in the NICU or anything like that. So that's not what I'm talking about. Just regular baby's good care. So with Virginia, I was the only patient on the labor and delivery floor, and the nurses kept coming in and trying to take my baby. They were bored, so they wanted to take my baby. They were like, just take a nap. We'll take care of her. But I wanted her with me, and I had plenty of support from my husband, and then my mom came and stayed so that my husband could be there more. So it just worked out that I was able to keep her in the room. It wasn't so much for other reasons than I just wanted to spend time with this new little life I had made, or I had delivered. I didn't make the life, I delivered the life. So that was with Virginia. Naomi and Samuel. Naomi, I wanted her around just because. Samuel was our first baby after our stillborn Joshua. We had Joshua, and then 11 months later, I delivered Samuel. 10 and a half months later, I delivered Samuel, and I just couldn't imagine letting go of him after that stillborn loss. And so I just held him really, really close and didn't let him leave my side unless he was with Daddy. But again, he still went to the nursery to do, the hearing test and those types of things. So then we had Josiah. While I was in labor with Josiah, which ended up being a really long labor, I needed Pitocin. There were some other things there. We don't feel that it caused his cerebral palsy because he was always really happy inside and never had any breathing issues or heart rate issues. But when I was in labor with him, I dislocated my knee. And so I fell on the floor, threw the nurses all into a panic. Mark picked me up and put me on the bed. And for the rest of labor, I was not able to get off the bed except for sitting on a rocking chair next to the bed. So that was a very difficult delivery, just because I couldn't move, and so I was uncomfortable with the contractions. But then Mark had to come home to be with kids after baby was born, and I didn't want Josiah being taken to the nursery when we didn't have an adult to be able to be with him. Not that I don't trust the nurses, I just want to take care of my own baby. We do have a very good hospital staff, so it's not that. But I found out at that point that they can do all of the infant care in the room. So they brought the scale into my room. They had the phlebotomist who had to draw some blood because of the group B strep issue that I have. They had to draw some blood. He was also a little preemie. So they had the phlebotomist come in the room and take blood right there. They brought the hearing test into the room. Everything was done in the room. He never left my side the entire time. So that was a really interesting thing to find out, was that I didn't have to send my babies out at any point. But with the dislocation of my knee, I couldn't fully take care of my baby because I couldn't get up off the bed holding a baby and possibly drop him or anything like that. So I had to call the nurses in a lot. While I kept him with me, I had to call them in if I needed to transfer him to another spot, like into the bassinet. If I needed to use the bathroom, I needed them to come in because I couldn't get to the bathroom myself because of the knee issue. So after Josiah, my next baby was Abigail, and I knew they could bring everything into the room, so I had them do that for all the testing. But I also was very, very adamant that I was going to do the baby care because I felt like I had missed a lot with Josiah that I wasn't able to do and had to keep calling the nurses to come help. So the nurses they kept coming into the room every couple hours, and they'd be like, "Are you sure you don't need anything? Because you haven't called us. The other patients all call us way more than this." And I was just excited to be able to actually take care of my baby since I had missed that opportunity the time before. So this is just an encouragement to new moms that you can ask for things at the hospital that may seem a little out of sorts. But remember that pregnancy is not a medical condition. Delivery is not a medical condition, and it shouldn't be treated as such. Our bodies are meant to go through labor and delivery. And while I really enjoy being able to be at the hospital because of the use of the antibiotics for group B strep, they are not managing my care as they would be if I was going in for surgery or if I was there because I had an illness. Pregnancy is a totally different thing, and feel free to ask for things to be changed if you're not comfortable with something, whether that be while you're in labor or while you're there for the couple days after taking care of your baby. Just feel free to ask your nurses Is this something that I can do? Is there something I can change about this if you're not feeling comfortable? There are a lot of things that go with having a new baby that you may not understand. I've delivered at the same hospital multiple times now, so I don't ask a lot of questions because I know what their setup is of how they, what they provide at the hospital and what I'm expected to bring and all of that. But just feel free to ask for, ask, do I need to bring diapers to the hospital? Are you going to provide swaddling blankets? I just found out my hospital doesn't give swaddling blankets to swaddle babies in anymore. They give you a little swaddler. I guess it's dangerous to have the fabric near the neck, so they don't do the swaddling blankets. I don't know, they've done that for all my other babies. So just know that it is your baby and your body, and you can make decisions. Feel free to ask. I know that I am not someone who likes to ask something that might be opposed to the system, but having this many babies, you don't have to follow their orders. They need to ask for consent. They need to make sure that you're understanding what is going on. And if you don't understand, feel free to keep asking questions. And if you don't understand, or you're not jiving with a nurse, you don't have, you have a personality issue there, ask for another one, because your body will labor best if you feel comfortable and if you feel safe. I was just having this conversation last night with a doula friend, and your body needs to be able to be in a safe place for labor to continue in a natural progression. And so if you don't feel safe, find ways that you can make yourself feel safe in that room. Maybe it's keeping the doors closed and asking that nobody comes in except your nurse. Maybe it's making sure your husband clears everyone at the door. I don't know, maybe it's turning down the lights. Whatever you need to do to make your body feel in a safe, comfortable place is what you need to do. Then after baby's born, you need to do the same with what you feel your baby needs for comfort. I remember at the hospital, they always give you this chart to fill out for how often the baby breastfeeds. Well, my babies, every single one of them has done what they call cluster nursing, where they just kind of eat on and off for 45 minutes, but they never really detach from the breast, but they aren't really eating that whole time. So they'll ask me, oh, how long did they nurse? Well, I don't know. They were there for 45 minutes and they drank some while they were there. But you need to do what is right for you and your baby at that time. If you have questions, the nurses and the lactation consultants and all of that are great for that. But you need to learn to read your baby's cues, and you need to learn how to comfort your baby in what is the best situation for you. So I hope this is an encouragement to other moms to be able to feel like they can reach out and question if they have things they don't understand at the hospital, and also to know that you can do the primary care for your baby while you're there. So we will see you tomorrow. Hopefully same time, same place, or maybe it'll be at the hospital. We don't know. So we will talk to you guys later. Have a good night.